Good morning. Welcome. Thanks for taking time in your busy schedules to dedicate an hour of space to think about what you might be able to do, what you might be able to do a little differently in your role as a leader here for the state of Utah. So today we're going to be talking about, in my opinion, a little more of a fun type of a topic that can have lots of different components that go into it. But the thing that I like the most about this is the majority of what we'll discuss today are things that are within your control of your role as a manager, leader, supervisor in the state, things that you can do specifically. So a little more practical here today and a little more touchy-feely, which for those that know me well know is not always my favorite thing, but I'm learning to have it be more of my favorite things. So with that, let's jump in. As always, this session will be recorded. You'll be able to view it in our YouTube library, usually within 24 hours. Shane's pretty good of getting it buffered and submitted there. So know that this is always going to be available to you along with the slides after we are done here. They'll also be sent to you in an email if you have registered to be here as well. So just quickly, I'm hopeful that the majority of you that are on the call have at least seen me here and there over the last few years now that I have been with HR. But for those that don't know me, my name is Sydney Alton, and I work on NHR for the Leadership and Organizational Development team. We do lots of different services for all of the employees across the state, and this is just one of the services that we provide. A monthly webinar to support leaders with specific topics that are current and relevant and timely out in the workplace. So thank you for, again, being here and taking some time to learn. As always, I like to, I've been trying to do this now for a couple of years, anytime I meet, to just take a few minutes and think about what is worth celebrating right now. What is going positive in your world, personally or professionally, what is happening that's going well in our environment, in the world, and just take some time to reflect on what we can be grateful for. Obviously, this time of year, that seems a little more top of mind. But just as you're thinking about that in your own successes and accomplishments recently, a couple things that are maybe worth noting, right? It's the holidays, and however your family decide to celebrate this time of year, I think one thing's in common, that we do maybe think a little bit more about the things that matter most to us, but also we set time aside to spend with, oh, excuse me, my camera's gonna adjust just a little bit. So cool. And then we spend time with those that we love most. And we usually dedicate, hopefully able to take some time off of work, but spend time with those that really matter most to us. So in the workplace, for many agencies, it's the end of the calendar year, not the fiscal year, but calendar year. And that means sometimes slower season, and sometimes that means busier season. But with it being the end of the calendar year, it's the beginning of a new year here too, and then, less than a month. So be thinking about what went well for us this year. What could we be doing different for next year? What have we learned? What things have changed? Just doing a lot of that self-reflection. This is a good time of year to do that. And then lastly, it's snow season. We live in Utah, and for those like me that are down in southern Utah, maybe the snow isn't always top of mind like it is up here along the Wasatch Front. But snow brings lots of different opportunities to get outdoors, to spend time on the mountains, to get some fresh air. I like the idea that it cleans the ground for the spring season, gives us a new fresh look, and is always really pretty. So I'm sure you've got a whole list of other things that you can are celebrating now, but take some time in the next while to really think about what you're appreciating in your worlds, and celebrate those things. Let's talk about what's positive and share some joy. All right, as always, we're gonna introduce you to the next off the shelf. So we usually don't do off the shelf in December, but this year was a little bit different because the last Wednesday was right before Thanksgiving, and I was not going to have anybody want to feel expected to jump on an hour call the day before Turkey Day. So we bumped it a week later. So thanks for those that rearranged schedules. So for our next off the shelf, I would say it wouldn't be in December, but it will be at the end of January. Again, it's always the last Wednesday of each month at 10 o'clock. Tara will be leading us out in January with this idea of delegating with purpose. Delegating is definitely a topic that people want to talk about, but then the idea of practicing it can be quite complicated and maybe even a new skill set. But the best leaders are those that know how to delegate well and are purposeful with it. So Tara will lead a really good discussion on some tips on how to do that and why it's important in the workplace and the role that you have in your leadership responsibilities and being able to do that and set that example for your team. So stay tuned to get registered for that. Shane will of course send out the link probably in the chat today, but also on your emails. Watch for that and you can get signed up and registered. All right, so then for today, there's about 3 things that I've designed for us to follow to make sure I want to cover today. And I think somebody might be off mute, so make sure that your, thank you, cameras are muted. Even though I would love to engage in conversation, it's not fun just to sit here for an hour and listen to myself, but that's for another time. So again, the agenda for today, we're going to talk about why workplace wellness and how it's helpful, not just for employees, but also for organizations and kind of the evolution behind that. And then some best practices and some actual resources of what we can be doing from an organization perspective to promote, support, and implement workplace wellness. And then lastly, more of the practicality here. So some strategies for what you're able to do as you continue to maybe create this idea of a culture of wellness on your team or your teams that you're managing. So some practical tips, things that you can do. So with that too, I want to be mindful that even though this topic is dedicated to the idea of wellness and wellness in the workplace, we are not spending time today talking about wellness tips and tricks and techniques. We have other experts in HR, but also across the state that is our primary role. And I'll share some of those resources at the end. So if you registered with the intent of maybe knowing how to meditate or how to have a diet and exercise plan, that is not what this training is for. This training is designed and the intention is to help you and your leadership role promote wellness for your employees, but also to see what the benefit is as you continue to do that for engagement, retention, all of those things, that more of the business perspective of why it is so critical to have a healthy workforce. And I would add to that, because we work in the public sector and are getting paid, of course, with taxpayer dollars, the healthier we are, the better example we're setting for the citizens of our state, but also promoting a healthy work environment so that other people are wanting to come and be attracted to working for state government as well. We all know how critical that is. So there's just that little reminder there for the caveat of the expectation for the content today.
Hello.
Hello, hi, can we make sure everybody is on mute, please? Thank you. All right, so as we jump in, I just wanted to do a brief introduction here to this idea of wellness. So Kelly Alton, that is my father-in-law, and he passed away just over a year ago. And as I was thinking about this topic, he kept coming to mind for a lot of different reasons, and I could spend the rest of the day talking about different stories with Kelly. He was such a colorful human being. Pleasure to have him as my father-in-law for the time that I knew him. But one of the things that stands out to me when I think about Kelly is his work ethic and the career choices that he chose to have throughout his life. And so we're going to just spend a half a second going through a little bit of that as an introduction to wellness here in the workplace. And so here is a cool picture for those that value. This is a real picture, and I think in the corner there it even says it's from 1977. But this is Kelly and his wife Cindy, so my mother-in-law, and then their 2 boys. So my husband's actually there in the red pants, and his little brother there on the right. But this picture was taken Yeah, in the late 70s, Kelly had gone through school here actually in Cedar City, and relocated to Emery County, and I'll talk about that in just a second, but for an opportunity to start working in the coal mines. And for those that are familiar with the mining industry or coal mines in general, Emery County is definitely the hub for energy, and back in the day, when I say back in the day, here in the 70s, if you will, it was booming, and it brought in a lot of families, a lot of employment in such a small area of the state. But Kelly jumped on board and relocated his little family over there and continued to live there until he passed away last year. But with that, starting his career there in the mining industry, there on the right, just I forgot to capture that. When he left the mines, this little statue was made for him, and we actually have it at my house on display. I love to see it because it reminds me of his work ethic. But with that, let me jump into this idea of him working in the coal mine. So I don't know how many of you might be familiar with the Wilburg coal mine. If you are, that is great. For those that are not familiar with it, it was one of the largest mines there in Emery County. And again, for those that don't know Emery County, I've got a little map here. I love talking about Emery County because the majority of our leaders across the state are not familiar with where it's at. So there it is, right in the middle of nowhere, a very small population, but really good people there that are dedicated to working hard to make their community continue to operate. But Kelly relocated there, took a job here at the Wilburg mine. He actually worked for a few different mines, but the Wilburg mine was known specifically because it had a very devastating fire that occurred back in the mid 1980s, I think 1984. And it killed, I think, 27 people. And for a small county, okay, Pam, yeah. So I wondered if there wouldn't be some relations here for those that might be familiar. Ironically enough, so my Kelly, my father-in-law started there in 1977 and left, I think, around July or August of 1984. Became an educator, got his master's degree, and went into the school system, and that's where he retired from as an educator. But during those 7 years in the coal mine, so just a couple months before this fire happened, who knows what could have happened, right, if he would have continued to stay there, if he would have been a part of that. But the idea of working here in the coal mine, if you think about that for just a minute, for those that maybe have had family or those might not have any experience at all even thinking about coal mining, there are still coal mines that are operating in Emery County now, but a lot of them have been shut down for multiple reasons. Some of those reasons include, right, safety risk, and we could go into the political side of it, I won't, but there's definitely a lot of risk for those that have chose to work in the mines, physical safety hazards. And one of the biggest things nationwide with coal mines was black lung. And black lung disease has taken the lives of a lot of people. And the reason why I'm going down that road, this will all come together, I promise, is because if you think about it, if you are finishing school or starting out in the workplace, how many employees back then might consider getting a job in the mine knowing that they're going to be exposed to a disease that will probably kill them, right? And so what did the mines do? They offered a lot more money. It was a pretty prestigious career as an incentive to, hey, come put your life on the line, literally, every time you come to work, and we'll pay you for that. And expose yourself to a risk that could ultimately have you lose your life early on. Outside of other physical factors. So because of all of the risks and exposures that the mining industry has as a workplace, Pennsylvania back in the 1860s actually put an act into place, one of the first legislative acts to help prevent black lung. But more importantly, one of the first acts that was passed through legislation to promote wellness at work. And wellness back then looked more like, hey, let's reduce the physical and safety hazards that employees are being exposed to, so that we can continue to have employees wanting to come and do this hard work. And so the act there that was passed in Pennsylvania required minimal ventilation. And if you can imagine in 1864 to where the mines are at now, I am sure that they are required to have more than just minimal ventilation is the only safety hazard to help promote a safe work environment in the mining industry. So with that, when I think about my father-in-law and his exposure there in the mines for those years, and then looking at now where we're at and how wellness has evolved during that time. So I've got this slide here. So just think about this, maybe your parents or your grandparents or even your great-grandparents, what they were doing for work and what that looked like day to day for them. And the risks and hazards that they were exposed to that reduced their ability to be healthy at work, or maybe to be safe at work, or to decrease illnesses. And think about how that has evolved, even in the last 100 years, maybe even in the last 50 years. Things have definitely changed in the workplace. One of them being that we have switched from having more of an industrial type economy to now a technological economy. And with that, the risks have shifted. And so we have evolved or shifted from having a lot of physical hazards and exposures at work to now more of the mental and emotional risks and hazards that come to the workplace. One of the biggest things here that current research is spending time doing studies on is the amount of stress that we endure in the workplace and how that affects so many components of our wellness and well-being. And so there have been lots of different things that have shifted as workplace wellness has evolved over the last several decades, and to think about what we're exposed to now and what we're able to do to continue to promote a happy and healthy workplace going forward. So with that all in mind, let's jump into exploring then the value. Why does workplace wellness matter? Not just for us as employees or even for your own workforce, but then from an organization. Why should employers care so much about the healthiness of their employees, and what value does that bring, the return on investment, if you will? So just quickly, there's lots of different definitions of wellness. This is one that I like the most because one of my favorite words of all time is balance. And I think in order to have wellness in your life, you've got to be able to try new things, make conscious choices, and in everything that you're doing to promote having a balanced life. And as you do that, you, in my opinion, often feel healthier in lots of different ways. And so we'll explore that a little more in detail, but overall that is what wellness looks like. Now, wellness in the workplace is going to look just a little bit different because now we're getting paid to do a job, and sometimes that job requires us to be exposed to things that maybe we're not exposed to when we're at home, or out in the community. And so being mindful of the choices that we make in our careers and what we're going to be exposed to. So as an employer, we've got to look at, okay, what are we asking our employees to be exposed to every day? And how can we promote this to be safer and healthier? And so as organizations look at that and start to promote more wellness and reduce these risks, the benefits they get from that, right? We reduce our health risks, which we all know is super important, that physical health component of it. But then it improves your quality of life, whatever that looks like for each of us. It enhances personal effectiveness, meaning we like the work that we do. We enjoy the employer that we work for. In our case, right, the state of Utah or whatever department or division that we're representing. We feel good about that. And as we feel good about the work that we're doing, the healthier we are. And then the benefits, it also benefits, right, the organization's bottom line. Now, in the private sector, that's going to look a little bit differently because they're worried about their revenue, their income. In public sector, what is our bottom line? It looks a little bit different. Making sure our employees are taken care of so that our state can continue to operate and function the way that it needs to, so that citizens still enjoy living here, right? And that the needs of our communities are met, that our communities are safe, and all of those critical things. We have access to healthcare, education, all of those things to help it be Still, I think if I looked at this right, Utah is still being viewed as the #1 state across the nation. So let's keep that up. All right, so I want to expose you as you think about, again, wellness here at work. There's these two terms that are becoming more and more common in discussion and research with workplace wellness. This idea of absenteeism. For so many years, supervisors hopefully have encouraged staff when they are sick or throwing up or not feeling well, that they do not come to work, right? We don't want them to be exposed to other people, bring the flu to work, bring COVID, whatever it is. We've gone through a lot of different physical health scares in the last little while, but when we have employees that are absent from work, meaning they are not physically present, we know that it makes it harder for everybody else in the workplace, right? There might be coverage that has to happen if there may be public facing or serving the public directly, maybe in an office setting, and their doors are open 8 to 5, and if they're not there, who's going to be there? But also, if you're working as a team and you're a team of 3 and one of you gone, now you've got 33% less productivity. So there are definitely things that happen when we do not have people come to work for whatever reason that is. And so often employees, but maybe even employers or managers, if you will, feel like, oh, I've got to have my people here even if they don't feel good, because we have to have a warm body in order for this work to get done. And so there's this balance that happens with being okay with and supporting employees to not come to work when they're physically ill. However, what the research is showing now is that presenteeism, meaning employees that aren't feeling well, whatever that looks like, if they come to work, that productivity actually is 6 times lower than if they weren't physically there at all. And some of the things that contribute to that is exposing other people to whatever illness they might have. But if they're not feeling well mentally, right, morale, engagement, attitude, behavior, all of those things negatively impact the rest of the workforce. It negatively impacts customer service if they're working with customers. It negatively impacts relationships and connection. And so as a supervisor, be mindful, of how your employees are feeling. And as we maybe encourage them to be physically present, know that we are finding that it's actually more harmful for them to be physically at work when they're not feeling well than it is for them to be physically absent. And so there's this shift in mindset of looking at the big picture of how wellness at work really can have an impact on everybody. All right, so for organizations to be able to perform well, meaning meet the outcomes and objectives that they're set out to do, it needs to have healthy people doing it. And the fewer healthy people that it has, then the worse their outcomes are going to be. As we look at wellness collectively, the Society of Human Resource Management, so SHRM, they put this wellness wheel together, if you want to look at it that way. There are lots of different models out there that promote different dimensions of wellness. This is the one that I chose that I think was most relevant. It divides wellness out into 8 different dimensions. And research has taught us that not one of these dimensions is better or worse or easier or harder or more or less important than another. And when you think about wellness historically, especially in the workplace, there's been so much focus on our physical health or our physical well-being, right? Are we dieting and exercising? Are we taking breaks and going for a walk? Are we eating a balanced meal? Are we getting exposure to how to manage, our stress? Are we being connected to nutrition counselors and fitness instructors? And all of those things add value, of course, to our wellness. But we know, and more research is being done on this, that our wellness is no longer just about our physical well-being. It's comprised of these 7 other factors as well. One of the biggest ones that is having a lot of time spent on it is this idea of our emotional or mental well-being, right? Our mental health is just as critical and important as our physical health. And it takes a shift in the workplace to understand that. You know, if someone's at home puking their guts out, we're going to be sympathetic to that. But if someone's at home because they had a really stressful night and we're up all night arguing with their teenager, do we value that less or more? You know, it's impacting their wellness and their ability to come to work and perform the job that they're doing. And so as we explore this a little bit further, check yourself on maybe your own bias here of what your employees might be going through with their wellness, you know, even in their personal lives. Those are maybe experiencing financial struggles, right? Maybe they've got laid off, or they've been in an accident and they don't have a vehicle, or they, you know, filed for bankruptcy, or they had, you know, unexpected things happen at their home. Financial well-being, you know, and the impact that it has on them to be able to do their job when they come to work. And so think about these different dimensions. This also gives you a good cheat sheet, if you will, to explore conversations with your employees when you meet on them one-on-one for your check-ins. Bring in these different dimensions and start to feel comfortable asking about their wellness in these areas, and know that it's critical to their success as an employee. Would love to spend the rest of the time even talking about those 8. You can explore that on your own. But what I want to do now is to have some conversation about the best practices and even some resources of what we can do from an organizational standpoint, but even as leaders for the state to continue to promote wellness and maybe do things a little bit differently. So once again, worker or employee health and well-being, showing up now, this is what the newest research is showing, is one of the main reasons why employees want to come and work for an organization. So I think it's been a while. We here at the state of Utah have promoted flexibility at work, but also, you know, a work-life balance. What does that look like? And so that is an attraction for a lot of people to come and work for the state. But in addition to that, what else are we doing to help attract new employees? We know that this new generation that are coming into the workforce has different expectations than those from 20 years ago, right? And well-being and the options that can be available to promote that is one of the top reasons why people want to come and work for organizations going forward. So what are we doing to stay competitive? The first thing we have to look at, right, it has to start from the top as an organization. There's got to be a strategy put in place. And I'm not just talking about a strategy for a wellness program, but actually promoting an idea of wellness and supporting it and being okay to discuss it and share what is going well, and not be fearful of not understanding the value that it brings to the employees, or to have employees feel like they can't discuss it at work. So organizational strategy is key first and foremost, of course, and then this idea of measuring our success. So how do you actually measure wellness? It can be so subjective, right? And so depending on what your role is, and if you start to look at this, research has taught us, quite a few different consulting firms have identified these are the 4 gold standards, if you will, of what you can measure wellness. You know, are your employees satisfied with their jobs? So job satisfaction, do they feel like there's a sense of purpose? Happiness, there is so much research going on right now in the realm of happiness. I kind of want to jump on board with it if I had some extra time, because it is such a cool study. And then stress levels. Right. So those are some things as you think about wellness that can be measured and be discussed to continue to promote this. Now, when we talk about well-being, right, it's not just about those 8 dimensions of well-being, but also the health and safety risks. So everybody hopefully familiar with OSHA, the Occupational and Safety Hazard Administration. I think I got that right. They go out, you know, and monitor businesses to make sure that they're in compliance with safety risks. They were established for lots of different reasons. One, to help prevent lawsuits and lots of millions of dollars from liability claims. But also they want to promote wellness at work. And so when we think about their standards and then, our standards, we have designated teams and experts that are employees across the state that are responsible to help promote safe work environments, not just physically, but also, mentally and emotionally and socially and all of those other things too. So being able to integrate all of those together is going to have us be able to produce the best outcomes for our employees. What we mean by having an integrated approach is being able to not only just all work together, but that our policies, our programs, our ideals, how we do our work day to day, all of that is lined with this idea of, is this promoting a healthy work environment? Is this promoting wellness for our employees? And as we align all of those policies, programs, procedures, day-to-day tasks with that in mind, the better experience that our employees will have. But also it promotes well-being across teams, but also for them to be healthier at home too. Because we know, just like when people are stressed at home, they're bringing it to work. Well, when people are stressed at work, we're bringing it home. And so how can we simultaneously support well-being in both environments? One of the things that we can do here is make this shift, a wellness shift, if you will. So historically, when we've tried to promote wellness in the workplace, it's done through what we call an I system, through individual interventions. We're going to focus on weight loss, maybe, or how to reduce stress, or how to have a healthier diet, eat healthier snacks, go for walks throughout the day, all of those things, and not to minimize the value or impact that has, because it definitely does. But those are all targeted for individual employees. And so what about the employees that are already physically healthy? Are they actually benefiting from this wellness approach or this wellness program or this wellness policy if they are already eating well and at a healthy weight and managing stress? Probably not. And so we lose credibility, if you will, with our wellness approach if it's not able to affect everybody in some capacity. And so shifting from an individual intervention now to a systemic intervention, where are we setting new policies that allow for flexibility and promote wellness? That's first place to start. Are we able to offer flexible work arrangements and schedules, and even look at the tasks that our employees are doing? Are we providing adequate training for awareness about mental health? Right now, there's still so much stigma about mental health, and it takes more discussion, more questions, more training, more exposure. I was reading in some of the research in preparation for this that there are more mental health accommodations in the workplace now than there are physical health accommodations. And so are we up to speed on what that looks like so that we can better support our employees and have that be a better work environment for them? So all of these things are some shifts that we can make systemically rather than just focusing on employees at an individual level. Other thing too, let's get our employees involved, right? More than we already are. Let's look at what are the things that are outside of the employee's control. So looking at their environment. An article that I just read that came out, I think, just a couple weeks ago. It's no longer about having healthier snacks and vending machines, or being able to go and have tennis shoes so they can go for a quick walk during their lunch break at work. Not that those things still aren't important, but the top two things that this article said with the study that they did that employees are wanting now in the workplace, in a physical work location, is natural light and good fresh air. So interesting when you think about our state facilities, how many employees have access to those things during their shifts. And so being able to think more creatively about the environment and how it affects our wellness. But then also, are we asking for feedback? Are we asking employees what they want, or are we making assumptions on what we think that they might need? And so being able to get them involved in that process, soliciting feedback from them, so that we can actually meet the needs of the workforce rather than just assume we know what they might need to feel better at work. So another tip there. Here is, I think, probably one of the most helpful slides, depending on your role, looking at what you can do, right, as far as getting innovative or creative to support wellness with your employees. Some of these things here, especially at the bottom, improvements that we can do to structure the way that jobs can get done, you know, even if they've been done historically one way for the past however long. Is there a better way to do it so that employees can feel better or enjoy it more? Are there steps that we can eliminate or steps that we can realign to make it more functional to meet their needs so they can continue to enjoy it? Are we looking at the workflow from start to finish? Are we allowing them more autonomy or flexibility over their duties and responsibilities, and finding out ways that they want to be able to do their work instead of just telling them? Now, with all of this, be mindful. I know that every agency and every role has specific things, but collectively, we don't know that there's a better way to do things unless we're discussing it and asking questions. And so it may mean that the way that it is needs to be the way that it is for now. But what else can we do, right? What is within our control? This last one, right? Being able to access healthcare. I was actually just having a discussion with my mom earlier this week about it. So long and Wasatch Front, when you've got to access healthcare for whatever appointment it is, right? You might have to take an hour or two from work to go to an appointment, whatever your appointment is, and be able to come back to work. Now, for those in the rural areas, being able to access healthcare looks a lot different than that, right? They might have to drive a couple hours just to get to a specialist and then have to drive a few hours back. So it might look like taking a whole day off of work just to go to a routine prevention appointment, if you will, or, you know, a regular doctor appointment. And so as a supervisor, for those that are maybe over remote workers or our rural workforce, are we allowing some flexibility to promote and encourage them to still meet their wellness needs, knowing it's going to look a little differently in the workplace? You know, can we realign a schedule? Can we have them come in early or late? Can we offer some additional time? Can we promote those things? And so being mindful of what you're able to do to get creative, to help your employees feel like they have support to be healthy too. Just some different ways to look at it. All right, I do this every time. I always get a lot of content and I spend too much time. So thanks for hanging in there. We'll get through this. Then lastly here, what do our policies look like? Now, so many of our policies obviously are governed through HR, and I'm not saying this just because I work for HR, but I do think that our HR workforce has the idea of wellness top of mind in all that we do. And so being mindful of having wellness policies in place and promoting those is one thing. We can always rely back to policy, but as a supervisor, are you aware of what these policies look like? And then are you promoting them with your workforce? Whether that's taking their time for 30 minutes to go and work, have a workout during the day, or promoting some flexible scheduling, or promoting their wellness visits, all of those things to align back on policy, and then not shaming or blaming them for using it, right? So there's also this stigma of, oh yeah, we've got policies there, but no one ever actually does that. Or, you know, for those that maybe are taking parental leave after a baby, we all might be doing this in the workplace because they're absent for the next, 6 to 8 weeks or whatever it is. And so be mindful, we have policies here to protect us and our wellness, but in a leadership role, we need to promote these in a positive way to ensure that our employees don't feel like they're at home taking care of themselves or their families and not being supported from their supervisor or from their team to take care of that. So be mindful of just even in our communication and how we promote wellness. Now, lastly here, this idea of creating a culture of wellness. Totally, again, what's within your control as a leader, manager, supervisor over your team or your teams, and what you can do to support them. here are some different ways to look at this. So anytime we want to take make any kind of a change, this idea of creating a culture of wellness, it's got to take some passion, some persistence. I would even add some patience, and then some persuasive leadership, right? It can't just be something that we say we're going to value and then not do anything about, or give lip service to of, oh, that's a good idea, we want healthy employees, but not know exactly how to do it. And so being able to speak to what we are supporting and to live it is the true role of leadership here. One of the things that we can do, and this is becoming more and more studied, I would say, with the research experts, lots of different companies are exploring this, but even just defining work. You know, for a lot of us, work probably look like 8 to 5, you punch in, you punch out, and you go home. And for a lot of different positions, it might always look that way. But think about even COVID and how that has shifted a lot of positions into, oh, some of this can be done, you know, remotely. Some of this can be done through technology. Some of this can be done from home. And so we're exploring different ways to get work done without your typical brick and mortar 8 to 5 type jobs. And what these leadership experts are studying right now is actually redefining work as a place of humanity and compassion, meaning that we're looking at our workplace as a group of people and not just a group of employees, and that we're treating them as people, as humans, and not just a cog in a wheel, if you will. That was great, timing of words, but that we're viewing it as a place where we build connection to support them in their whole self, coming to work, and not just as a number or a warm body to sit in a chair and fill a role. So as we explore some of these concepts, think about your own team here and viewing them, you know, as a human system as opposed to maybe just a work unit. New research has identified that workplace culture, whatever that looks like, whether it's culture of wellness or not, but just the culture at work is now the biggest roadblock that employees are facing in order to feel healthier and happier at work. And one of the leading reasons why employees no longer want to work somewhere, and we're losing employees. And so we know that the healthier and happier that our workforce is, and if we have a culture that's promoting that and living it, that we are more likely to attract and retain our talented workforce. So as leaders, we need to make sure that we are discussing this at every level, and that we have all agreed that having a culture of wellness is essential in order for us to have the best high-functioning workforce that we can, in order to continue to have our state operate the way that it needs to, and continue to be innovative and make change. And so as a leader, part of that, we've got about, I think, 4,100 of you or so supervisors across the state. Your role in that is to continue to support that and discuss it to ensure that it continues to happen. And this is interesting too. So when we look at your skill set as a manager, this idea of people management skills, these can be your interpersonal skills, your soft or your durable skills, your ability to be liked, your ability to communicate, like I said, your interpersonal effectiveness. That's what we mean by people management skills. As we enhance those types of skills, we can reduce turnover of our staff by 60%. So the better you get at being able to work with people and manage people and seeing them as people and not just employees, you can help reduce that turnover, which is critical, because none of us like to have vacancies on our teams. So again, here are, oh, my camera, I apologize. I've got to get this set up for better for next time. So thanks for being patient with that. Here are the tips of what you can really do. Some of this touchy feel good stuff, but it makes such a difference, you guys. So please, as we go through this, think about, maybe even choose at least one of these things that you want to take back and say, that's what I want to focus on. We discuss all the time the idea of rewarding and recognizing and praising our employees. We understand the value that it brings to the employee, but also recognition. When we do that, it helps well-being to thrive. And as we provide additional recognition experiences that are genuine, your employees start to feel better about each other, or about themselves, and then about each other. And it becomes a domino effect, right? And so that's what we want, to have these positive, praising teams that support each other in their well-being. We have lots of different, again, another topic here, we could spend all day on this idea of psychological safety. What does that actually mean for those that haven't been exposed to it yet, right? That we are giving our teams, our employees, the space to be able to say what's on their mind, their concerns, allow them to be able to make mistakes without being ridiculed or to be made fun of or embarrassed, allowing them to try new things, even if they do fail safely. This idea of being recklessly good that we've heard about, for over a year now, all of those things help to promote and create psychological safety. But also there's this expectation then amongst team members that they're allowed to take risks and they're not going to be shamed for that, or maybe even rejected. Right. So it really creates a safe space for people to learn and to grow and develop in a safe way. But we also know, and this is probably in my mind one of the most critical things, is it pertains to our wellness, that when we do have a psychologically safe work environment, or our team is psychologically safe, or managers are promoting psychological safety amongst their workforce, it reduces stress and anxiety. And for all of us that have jobs, we all experience stress and anxiety. It's something that we can all relate to. And so in a leadership role, as you promote psychological safety, you actually are reducing your own stress and anxiety too in your role. And so make your jobs easier and make it a safe place to work for everybody. This idea might seem a little punitive when you think about ignorance, because when we think about somebody maybe being ignorant, we view that maybe as a negative thing. But really, when we're being ignorant, or we choose to ignore certain behaviors or attitudes on our teams, they've labeled this as emotional distress. When our behaviors and emotions and feelings and the things that stress us out or cause us to not feel well at work, when a manager ignores those, meaning, oh, I'm not going to address that today, they'll be better tomorrow, or, I don't have time for that, they'll figure it out, or I don't even know what to say to them right now because they are struggling and I can tell that they're upset or they're frustrated or they're sad. I don't even know how to deal with that. So I'm just going to let them deal with it, or hopefully somebody else does. All of those things are ignorant behaviors. And that doesn't mean that you are necessarily an ignorant person, but what we can do to reduce our ignorance, let's get uncomfortable supporting emotional distress amongst each other. Let's get comfortable asking questions. Let's get comfortable taking and addressing these emotional distresses that happen at work and being empathetic, showing some compassion. We're going to talk about that in just a second, and being able to promote the idea that it's okay to come and have those feelings and they've got support at work to be able to still do their job and feel okay with it. So the more that we choose to ignore those behaviors or those attitudes, the more harm we're actually doing to productivity, to engagement, to morale, all of those things. And so be mindful of what you're choosing to ignore out of your own discomfort or out of your own maybe lack of awareness of how to approach it, and get comfortable with some of that. In order to get comfortable with it, we've got to learn to be vulnerable. And what does vulnerability really mean in the workplace, especially in a leadership role? That we are able to talk about the mistakes that we make, that we're able to show our own emotions in a healthy way, right? And emotions don't always have to be a negative emotion. We tend to associate that. We can show our positive emotions. What makes us really excited? What do we love? What do we value? What are we passionate about? All of that is emotional too. And then we're humans just like our workforce, right? So when we are going through hard times or challenges in our personal lives, doesn't mean we have to share details if we're not comfortable doing that, but to say, hey, I'm having a hard day today too, and I might need some space, and as you are willing to share and be vulnerable with your staff, the more likely they are to then reciprocate that and show their vulnerability to you, others, and that you can support each other through these challenging times. Vulnerability, I think, is one of the, in my opinion, lots of research would support this, right? Vulnerability is one of the biggest skills and best skills that a supervisor can have. And so again, right, so as managers and employees share this idea of vulnerability, it establishes this culture or a workplace of humanity where we're viewing each other as humans and not just co-workers. So last tip here, being able to demonstrate compassion. And what does that actually mean to be compassionate? When we show compassion, meaning that we are recognizing the emotions of others and being able to offer support, patience, time, whatever it is, to let them know that you care, right? This is just the idea of being able to share that you care about that person. Doesn't mean you've experienced what they have, doesn't mean that you need to know everything that's going on. What they need to know is that you care about them. And as we do that, employees, if they feel like they have a compassionate manager and their workplace is a place of compassion, they actually become more innovative, they become more adaptable, and they deliver higher quality work that's consistent. So that's obviously a win for the employee, but also a win for the organization. We talked a little bit about this idea of humanity here. I've shared before in the past, one of the best pieces of advice that I got years ago from one of my administrators, some feedback that was critical for me, was to be able to be human at work. And I've joked about it before, but I Googled for quite a while how to be human at work, as silly as that might be. And so much of what that is being able to view people as people, being able to view people as humans that are experiencing emotions that might make it hard for them to do their work, or experiencing things in their personal lives that they are struggling with. All of us have gone through that. All of us will go through that. And so in a leadership role, how can we build that connection and share with them what they're going through and support them with what they might need, getting creative to still be able to do their job. The majority of people still want to be able to come and do their job, even when they're going through hard times or struggling with whatever that might be, health, a loss of a family, changes, mental health, finances, all of those things. Some people might even be confused about what they want to do long-term for work, right? They're trying to establish their career path. All of those things are things we can all relate to as humans. And so let's start seeing each other more as humans. Lastly, as we finish up here on this idea of promoting and supporting workplace wellness, this is what employees are saying that they want, right? I touched on that, but I've got some statistics here. Interesting, in studies, you always wonder, well, who did they actually study? But I found similar results on a handful of different studies here, but more and more people are saying that they would actually take less pay if they could have a feeling of well-being at work. Right, so being healthier and feeling healthier at work and being supported in that and feeling well and enjoying what they're doing is becoming even more important than how much they're bringing home on their paycheck. And so be mindful as you look at your workforce and even look at where you're at in your career and the opportunities that you have. How important is wellness to you? What are some things that you can do differently? And what are some things that you can adopt? What do your employees need? And let's continue to advocate for an even healthier workplace than what's already been afforded to us as employees. As we continue to do that, keep in mind we have all chose to be in these roles as public service workers. And with that comes a variety of different responsibilities of managing resources and budgets, taxpayer dollars, doing more with less, maybe not always getting the praise that we need from our citizens because they don't understand the work that we're doing or because they think that's what we should do, being viewed as the government and some of the stigma that comes with that. There are so many benefits that come from working in public service and so many things that we can do to promote wellness in our leadership roles. but also, you know, when we look at ourselves as employees, and then also look at the employees that you're managing, what potential do they have to be healthier and to achieve wellness, and then viewing each other as citizens, right? We're all living in the state of Utah, and we all want to be able to continue to live in a state that promotes health in the workplace, but also just healthy communities, healthier programs for our kids to be able to access, jobs where we can find pride. So the last thing here, viewing each other just as individuals, you know, in our families, as friends, as neighbors, but at the bottom line, as humans. So thank you for taking some time here in exploring wellness. For those that maybe signed up thinking they were going to get some specific training on wellness tips, we have a vast array, like I mentioned. So I want to make sure you'll have access to all of these links as you get these slides. I received this from our wellness group at HR. They were great to partner with, so appreciate them and their work. But PHP offers a ton of stuff. We've got Bloomquist Health that has a lot of resources available, URS, our Utah Retirement Systems. There's also other offerings, as you can see here. Lastly here, a new one that I had not had exposure to, wellness councils. I know a lot of agencies have incorporated that. There's some really cool stuff, and there's actually even money, grant money, that could be available to help promote some wellness programs. So if you have teams or employees that this is kind of their jam and they want to make some change, get them contacted with your agency representative so they can jump on and get these resources to help offer some wellness resources internally for your team. So I know there's a lot more, but these are what are available to us from a state perspective. So with that, please get signed up. Shane sent a couple links. Get excited to hear from Tara. She's always super engaging and super fun as far as her presentation style. So get registered for that and look forward to that in January. And again, thank you for all the work that you do. I appreciate being able to serve you, and happy holiday season to everybody, and have a good afternoon.